So welcome to the Hemophilia Council of California's webinar, GHPP, How to Apply or Renew Your Application. I'm Lynn Kintz, the Executive Director of the Hemophilia Council of California. Thank you for joining us today for this important topic. Questions. I'm scrolling back up in my chat here because there have been lots of questions and I want to try to get to all of them, so bear with us. I know there was a question about cost ranges for enrollment fees. I actually do not know what the top end of the cap is. They are based on income, but I do know that depending on income, you may not have an enrollment fee. So it is possible that it could be as little as 0. I do not know what it caps out at though. In terms of the top end. So we will have to find that out and get back to you on that.
And because GHPP is 100% state-funded program, that's another reason why they have to have the annual enrollment fee. But again, they can work with you if there is a hardship, if you can't afford to make that fee. You can break it out into payment plans with the state. And in some cases, they can actually waive it. So that's why it's critical to work with the state GHPP program on that.
There was another question, if a patient had Medi-Cal and their plan does not cover in-home transfusion or home health aid, would GHPP then cover? I will say, all of those questions can be a little bit specific to the exact nature of the patient and perhaps why that was being denied. It might have been a challenge of managed care on Medi-Cal. But if the patient has a GHPP qualifying condition and they are on Medi-Cal, it is often a good idea for them to go ahead and be enrolled both in Medi-Cal and GHPP because it really kind of can't hurt to have that additional coverage because the GHPP may then pick up as the secondary insurance things that the Medi-Cal does not cover. There's a question about, there's several questions here, how to get mental health services. There is information on the GHPP website about accessing services. I don't have a lot of specifics on the mental health services, but we can look into that and try to post some information along with the webinar. Related to the stability of GHPPs financially, given the state budget situation, that's always a concern that when the state is in budget crisis, that GHPP or CCS or Medi-Cal, any of those safety net programs could be cut in some ways. So we do appreciate, and that's a big part of what HCC does, is to advocate for those programs every year, along with our other partners in the community and in the rare and chronic disease community. But I will say that thankfully over the years, through hard work of advocates, we have been able to maintain those programs through difficult times. So I hope that we can continue to do that even in the coming year with the budget challenges that we will be facing. But please, stay connected with your local patient advocacy groups and help us to continue to make that case because that's a very important thing.
And Terry, again, I was going to say, work with your physician and care team because they are the ones that can assist you with contacting the folks that run GHPP. We can do that at the council as well as Cyan Wellness and the Sickle Cell Disease Foundation of California and some of the pharmacy providers that work with the community as well can help interface and help assist you with those applications. Generally, it's pretty broad covered services. So sometimes if you're having difficulty getting the approval, it's probably from lack of medical documentation that needs to go in with your various applications. So just continue to provide as much information as possible to the state so that they can be there to help you. And someone put a question on the BIC card. that is something that's a high priority of the council as well, and we'll be working with the state on that. We raised that with the new director, Will Lightbourne. We talked to him about the quick processing of all of the outstanding GHPP applications that are in the pipeline, and we talked to him about bit cards, and he committed to work with us on both. So those will be top priority issues for the Hemophilia Council going forward this fall and into next year.
There's a question here, how long does it take for new members to get approved? In the past, some webinars that we've had with the actual folks from the department at the state who've presented, I think they've indicated about 4 weeks. But as I mentioned earlier, we have recently been seeing some delays in processing. I know the state is working on that and trying to catch up on those processes, but because of those delays, that's why we're really recommending that folks try to get in renewal applications with a more like a 2-month lead time and not just leave it to a month out to do that. Someone asked how to provide application assistance for clients. You absolutely can download applications and help clients through that process. You know, take them through these steps. This webinar will be available to share with people and this information and kind of give them a checklist. So I think those are all ways that you can be helpful for folks trying to apply, maybe double checking the application process with them. And I know that in the bleeding disorders community, you know, sometimes the folks at the treatment centers, for example, the social workers and or folks at perhaps like a specialty pharmacy may even help a patient reach out to the state when there's delays. So there's a question about how many staff members are processing applications. I'm actually not sure how many positions the state has allocated to this. Terry, do you have any thought on that?
I don't know the number. I know in the past they were understaffed, but I believe they have staff in both the LA office and in the Sacramento office helping with that. So they're well aware and they generally can process things in a pretty timely fashion.
So there's a question about needing to be approved for medical first and then not qualifying because of the amount of assets. Barbara, you might want to reach out to one of the foundations to get a little bit more assistance on that. You wouldn't be disqualified from GHPP because of assets. You might have an enrollment fee based on your income and your assets, but you wouldn't be disqualified. So
correct. The state makes you apply for Medi-Cal first generally, or they'll send you in that direction. But if Medi-Cal denied you, then you should be eligible for GHPP just based on your sickle cell disease condition. And there was a question related to that if their plan doesn't cover home transfusion or home health aid, will GHPP then cover? Generally, yes, but again, you have to work with the whole medical care team and with the state. So I'm not sure that means transfusion or infusion, but I have heard, and I'm not an expert in sickle cell, I have heard most sickle cell infusions are done inside the clinics versus at home, but maybe that's changing. And so again, that would be an education issue where you need to talk with the state and work with the folks there at GHPP, because normally infusion for factor is allowed in the home setting. I'm not sure about for sickle cell, but home health should be covered.
Yeah. There's a question about utilizing tools like DocuSign or an online software to expedite application processing. We did just initiate a conversation with the state about like a secure email system, so that more of the special care centers that are trying to assist patients with submitting applications would be able to do that via email, because currently they usually end up having to mail it or fax it because the email system does not accept secure emails, and due to HIPAA, the medical teams cannot submit the applications for the patients via email. So there is some potential movement that direction that we've been exploring with the state a little bit.
And I see a question from Barbara to everyone saying I applied directly but never got a response, called 3 times. I can give you some of the contact people at the state. So some of the folks that have emailed me or that can email me directly, I can assist with who you need to reach out to on that. Happy to do that.
Will GHPP pay COBRA? I don't specifically know the answer to that question. And there's also a question on, is there an income cap for the HERPA program? I did not see that in any of the documentation, but I don't specifically know that either. So we'll try to gather a little bit more information on that and post it with the other materials from the webinar.
I mean, the exciting thing, this is Terry again, is a lot of these conditions were only childhood conditions. And so many of you are now living into adulthood and thriving and doing really well. And so we feel that it's really important to continue to maintain access to programs like GHPP for all of you who are living and thriving.
There was a question about the BIC cards and patients, not having received them. That doesn't surprise me to see that somebody posted that, because that's been some of the feedback that we've received. We are working with the treatment centers and specialty pharmacies to gather more information on that so that we can take that back to the state. So we will, Patty, I will follow up with you directly on that. We do have some information about how to apply for that card, and we kind of want to test it out and see how it goes for the folks that apply for it, if they are able to easily get one when they request it or not.
Yeah, Patty, that was one of the big things we brought up when we met with the new director of Department of Healthcare Services, Will Lightbourne. We brought up they need to expedite the processing of the GHPP applications during COVID, and they need to work with us on some kind of workaround or fix for the BIC cards, because the state said they are sending them out, and we're hearing from many of you that they're not doing that for GHPP. So it's an ongoing top priority issue for the council to keep working on.
Terry, do you know, have you had cases of this in the past, of GHPP covering services for someone when they were out of state? I would assume this would be like in an emergency situation, like you're traveling and then you end up out of state, or I guess it could be a situation of a student as well.
Yeah, I was thinking college students. That I don't have real good clarity on. We probably need to address that with some of the folks like Barbara Sasaki and others.
Okay. And there's a comment about the BIC cards causing confusion. We've also heard that feedback as well. We really heard feedback from some providers and patients who really want GHPP patients to have the cards and believe it will be really helpful for them. And we've heard from others that have had issues with it being confusing before. So it's just an issue that we continue to work on, trying to strive to create more access for patients. So I will follow up on the emailing the HERPA information. It is on the GHPP website. Somebody asked about the maximum income allowed. There is no maximum income allowed, but there will be a higher enrollment fee if you have higher income, basically. So on terms of checking on the status of applications, that has been a challenge, especially recently. I do believe that the best way to try to do that is probably via that email, which is, I'm going to go ahead and switch this page. It's that GHPP eligibility email. Go ahead, and I would encourage patients who have submitted an application to email that and be as specific as possible about when and how they submitted their application, and request a reply indicating if it was received and where it is in the process. Terry, did you want to clarify on the applying for Medi-Cal first? Are they required to apply for Medi-Cal first?
So for most of the patients that had already been on the CCS program, and then they can just apply to GHPP. But if you're brand new to the state, you've just moved here, and they generally ask that you apply for Medi-Cal first, but that is a complex process. So they like to see if you qualify for Medi-Cal or Covered California. There's a no wrong door. It's one application, and they'll steer you the right way. And then if you don't qualify, then you would apply to GHPP. So I think you are still supposed to do that first. But again, you can have a combination of Medi-Cal and GHPP, a combination of Medi-Cal and CCS. You can have a combination of private coverage and those two programs as well.
And I think that we made it to the end of our questions. So I'm sure that there are still some outstanding issues or things that folks are learning and understanding, but those are all the ones in the chat. So some of the questions that we weren't able to answer as fully, maybe we can do like a follow-up posting on the website with some answers that we're able to receive from that. So hope this was helpful for everyone. I want to briefly just say thank you to everybody for joining us today. And also thank Terry and Rigo for helping to present this information, to thank Takeda and Sanofi Genzyme for sponsoring our webinar series. And thank you for joining us. Thank you again. Clearly there was a lot of interest in this topic, so we appreciate you all joining us.